There is an outbreak of syphilis in New Brunswick. Between 2000 and 2006, 1 or 2 cases of syphilis were reported every year to public health. In 2010, almost 40 people were reported to be infected with syphilis. At the present time, in New Brunswick, syphilis affects mostly men. Many of these men have had sex with men and had multiple sexual partners. Syphilis is mostly spread by having unprotected oral, anal, or vaginal sex with an infected person. Syphilis is a disease that often is asymptomatic. Symptoms of syphilis are not always obvious. The first symptom is a painless lesion that looks like an ulcer and appears where the germ entered the body and may not be noticed, depending on where it is on the body. This happens within 3 months after having had sexual contact with someone infected by syphilis. The lesion will go away without treatment. Later, other symptoms may happen within 6 months from sexual contact. They include a body rash, often including the palms of the hands and soles of feet, and possibly flu-like symptoms such as muscle pain, swollen glands, fever, and headaches. Sometimes there's even hair loss. These symptoms eventually disappear on their own without treatment. Following this, if untreated, syphilis may go underground in the body, spread and cause damage to many body organs, but without any further symptoms for a few years. You are at higher risk of being infected with syphilis if you had oral, anal, or vaginal sex without using a condom, are already infected with another sexually transmitted infection, have multiple sex partners, have sex with anonymous partners, or know little about their sexual practices, or had sex with someone infected with syphilis. If you already have syphilis, you are at higher risk of being infected with HIV. If you think that you may be at risk for syphilis, or if you have symptoms, you should be tested. It's a simple blood test. Visit your family physician or nurse practitioner, or go to www.gnb.ca/Junio for testing and treatment sites in your area. You should also be tested for other sexually transmitted infections and for HIV. If you are infected, it is important to inform your sexual partners because they should be tested and treated. Your healthcare provider or nurse from public health will ask you about your sexual partners and help you with this. There's a cure for syphilis, especially if treated early. The treatment is quick and easy, usually penicillin given by injection. If you're allergic to penicillin, there are other options for treatment. For more information, call your healthcare provider or your local public health office.